Hello, and welcome to Shared Space, a podcast about how we connect, live, and heal, and the surprising role of the spaces that surround us. I'm your host, Erin Peavy, and I'm so happy to have you with us today. Today, I'm talking with Patricia Gruits, a senior principal and managing director at Mass Design Group. Her work has been featured in journals of architecture and design, as well as the BBC World News and the Discovery Channel. And I am super excited to have her here with us today. Thank you, Patricia.
Thank you so much for having me. Honored to be here.
You know, when I saw you guys' amazing work on the important topic of social interaction for older adults during the pandemic, I was like, yes, I've been looking for this. So I just jumped on the chance to have you to be able to share this work with our listeners. So I'm super pumped. Before we get into the meat of everything, say a few words about your background, who you are, and the work that you do at Mass.
Sure. So my background, I was born and raised just outside of Detroit, Michigan. I went to the University of Michigan. Was always interested in social justice issues. Was really engaged at a young age. My grandparents actually started a nonprofit, a medical center in Haiti. And so had like a really, yeah, back in like this in the 60s and 70s. So kind of always had that as like a North Star, I think, for my own just like goal as I was pursuing my own education and own career. And was fortunate enough while I was at school to really be inspired by architecture. I wasn't quite sure that that's what I wanted to do, but was just inspired by the field and ended up in an architecture studio and just knew that that's like how I wanted to express and find this intersection between design and social justice issues. And was fortunate at Michigan because it's such a large program to just be exposed to a lot of different faculty and a lot of different ideas. And was really nurtured to kind of pave my own path. I mean, I was in school in the early 2000s when, design for impact really wasn't a term, or, social design. Obviously, there have been movements, throughout history where architects have kind of come in and, made a point of sort of refocusing the profession on humans. Who would have thought? So it was something that, was really nurtured at Michigan. And I was lucky enough to come into the work and studio of Sheila Kennedy, who had a firm out here in Boston called Kennedy and Village Architecture. And together we created this project, which was called Portable Light. And it was
Portable Light?
Portable Light project.
Nice.
And it was a sustainable source of like power and light. So this like flex, and it was embedded into textiles, which was my kind of passion and background in fiber arts. I studied it through college and was really just interested in how that could lead to space. And so with Sheila kind of leading the project, we took these solar lanterns and this kind of idea of integration into native and local construction or fabric constructions, and went to Mexico to work with the indigenous group there, and then went to Brazil to work with another sort of indigenous community outside of Santarém, Brazil, and in the Amazon. And so kind of had this exposure right out of school at this like wonderful intersection about how design could be applied in the real world. And at the same time, I was still working at KVA, where it was, kind of really nurtured into like the actual practice of architecture. And so came to Mass, 7 years ago, really interested in how I could learn from others and apply this thinking outside of just this one project, the Portable Light project. And, Mass was doing that kind of work. They were thinking about co-creation. They were thinking about the design process and how we changed the way that we build.
Yes.
And so it was a really exciting moment. Mass was growing. We were starting to get outside of Rwanda, where we were founded 10 years ago. And of course, we were founded, in a response to an epidemic disease, which now, has always felt very relevant, but to our work. But now, just given the COVID-19 pandemic, is incredibly relevant. And, in the first hospitals that we designed, we were designing for like, drug-resistant tuberculosis. when we were working in Haiti, we were working with like cholera epidemic in Liberia, like in the wake of Ebola. And so, well, we definitely had some unique experiences that made our presence now in the US, now that we've sort of transitioned to have a really strong office, not just an office in Kigali, Rwanda, but to have an office here in Boston and in the United States, working in Santa Fe and in New York. Just found that we had some research and some lessons learned that we could offer people.
Yeah.
And so, at Mass, I've done, as you mentioned, like a lot of different things, everything from maternity waiting homes to a series of schools. Abroad, also working on larger universities in Rwanda. Spent some time living there with my family and moved back to Boston in 2018 to have my son, and really started to focus on how I could take what I had learned personally, sort of through our projects abroad, and how I could bring that here to the U.S. and really focusing on Boston, which is my home now. And so have been spending the last 2 years working on a lot of affordable housing projects, and really looking at this intersection of health and housing.
Yeah.
And trying to think about how we can also create tools, resources, and guidelines that others can learn from. So
that's awesome. That is very cool. So, one of the kind of questions that I had was just around how you specifically decided to take on senior housing during this pandemic. I think that you started to kind of hint at maybe some parallels, but what made you tackle this topic?
So for the last 2 years, I've been working in Boston, and one of the sort of topics of one of our projects is specifically senior affordable housing, or age-restricted affordable housing. And it's already a very challenging typology to design and build for. There's a lot of things that are just in tension, whether, understanding,
Yes.
an individual's need for like control and agency and autonomy, designing in between spaces that want to be really flexible, but then also needing the specificity of like senior needs and seniors to be able to age, from really 65 to, in their 90s, like the different needs that those age groups and that someone on that continuum will need and experience. And also just this general tension between, how we think about institutions versus homes. And so when COVID hit, we were really, really fortunate to already be in conversation with some really incredible partners who were thinking about new ways to think about housing for seniors.
Mm-hmm.
And we're in these conversations as they were thinking about how they could adapt their space, some of the lessons that they were already learning, some of the questions that they had. And as designers, we had one point of view, and as developers and housing operators, they had other insights and other points of view. And so we just started to bring people together, kind of just to learn. And, we have a network internally at Mass that allows us to kind of tap into these different disciplines, to have developers, architects, housing operators, funders, all at the table asking these same questions.
I'm like, I'm sorry, everything that you just mentioned,
No,
I feel like is this like perfect. You need all of those aspects, because without that, you're sort of trying to move this lever where the other levers are like, nah, I'm good. That's great.
No, it's my favorite. It talks to like the methodology, I think, a lot at Mass, which is that we are not necessarily experts, but we are able to sort of speak to and bring together experts and people with different perspectives to build consensus around ideas. And so really it was just rooted out of these conversations that we felt we were really fortunate to be having, and felt like there was a lot of need for more people to be talking about housing, and specifically for seniors. And again, like, the unique issue about seniors, I mean, there's so many, they're not only at like higher risk, like we know that, but the solution, the sort of, the solution or the sort of anecdote to infection control was like, well, just distance yourself from others, social isolation. And that's like a huge threat to our senior population. Research has said that it's just as bad for you as smoking. And that I think is something that we just felt was something we could react with in fear. We knew, there's a way that you can design for fear. Or design for illness.
God, well
and
said.
And we felt like we needed to actually be designing for joy and designing for hope and designing for community and interaction.
Mm.
And so these conversations, yes, some of them were very serious. Some of them were full of sort of the what if and the fearful kind of question of what if we have an outbreak, what happens, what do we do? But also how could we bring life back into these spaces?
Yes.
How could we start to reconnect people? And could we actually come up with some solutions that allow people, not for, we're never going to get to infection elimination,
Yeah.
but true infection control that allows for us to live our lives.
Yeah.
And so that's really its genesis. Again, like, in terms of, again, bringing people together, we're really fortunate to have wonderful partners and reviewers on the project from, Jen Malinsky at the Joint Center for Housing Studies at Harvard. She graciously gave us her time and her insights and support and contributed to the research in the guide.
Mm-hmm.
Emi Kiyota, who is this amazing architect and researcher who has really spent a lot of time specifically understanding the needs of older adults,
Mm-hmm.
and especially extremely frail older adults.
Yeah.
And so she was another collaborator on this guide. And yeah, we're able to kind of pull people together and hopefully put something out there that others find useful.
Yeah. Like we were talking about earlier, when all of this hit, I was going to talk about loneliness and the built environment and, looking at the, sort of the isolation, the forced isolation that we all, had to go through for our own safety, just really, to me, begged all of these questions around, well, how else could we live? I just think the way that you said it, designing for joy and hope and connection rather than fear. And it's not meaning to ignore those components, but find where are the synergies in those components. And I think that you guys did a really beautiful job of doing that. I especially liked this one quote that you guys had, which is, where other guides focus on how to keep people distanced from one another, this guide is aimed at achieving infection control principles while offering solutions that allow people to safely come together. I was like, yes, like all caps, highlights. Yes, this is what we need. And I think that and we're going to dive into the principles that you guys came up with. But I think in that I think there are a lot of synergies across multiple different types of housing and beyond. I did just want to mention some of the just stats that really stuck out to me from your report, just for anyone that's less familiar about some of the senior housing and COVID statistics in general, which I knew a little bit about, but still was struck by. And of course, this was published in June, so this was data that has of course changed since then. But I was looking at about 80% of the deaths were people that were 65 and above, and even though only 3% of seniors were living in nursing homes, assisted living, that type of sort of group setting, almost 45% of the deaths of seniors were coming from those areas. Is that correct? Am I reading that right?
Yes.
That's nuts. That's nuts.
Yeah, it's a staggering statistic, and it took us a while to kind of unpack that. I mean, also trying to unpack where all the different places where seniors live.
Yeah.
Was all, and the way that different risk profiles were generated for those seniors based on not just where they live, not just their zip code and the type of housing they have, but also the type of care that they've set up for themselves, whether it's a family member providing some amount of care, whether it's a vendor or a caregiving service, or whether it's actually provided in home. It's this unbelievably amazing web of just trying to understand, where seniors are and how space relates to their risk of infection.
Right. So about that specifically, I think that was one of the things that, it was such a takeaway from you guys' report, which was just that looking at that stat, you can't help but go, all right, so where we live and are the environments that we live and how we receive care is going to influence, our chances of getting COVID, surviving COVID. And so, I just thought that was really important, to sort of say, okay, and how can we be safe and still happy? Because the truth is, like, you had talked a little bit about, just the negative health impacts of loneliness and social isolation. I have been seeing and hearing from my colleagues that work, as clinicians in senior housing, just hearing about, the day-to-day routines that people had that involved, connecting with their like their wife, for instance, that was on a different unit, and their inability to get to see each other anymore, and what that does, and sort of watching their cognitive decline, watching their weight loss, because they just don't want to eat anymore because they're not eating in community. So I feel like that can't be overstated.
Yeah, no, I mean, I agree. I mean, what I think, this pandemic has done across the board is kind of reveal all of the cracks and further exacerbate the cracks that already exist, in the systems around us.
Yeah.
And yeah, senior living is one of the systems that I think for a long time advocates have been, out there talking about how it needs to be improved, and how at risk our seniors are. And I think this is just showing really, one of the kind of demographics that are disproportionately affected because of the sort of structural system that's been constructed around them.
Yeah.
And so when you think about like the institutionalization of like our seniors, really, really intense. It's actually, it's kind of a funny thing that came to my mind, but so I mentioned we had been working on this senior housing project. And so when I went to Rwanda to visit one of my projects over there, I went out to dinner with a few of our colleagues who are Rwandan, and, was talking to them about this new project and how exciting it was and how cool it was to be working with this partner on it. And he stopped me and he said, I don't understand. In the US, why don't you take care of your elderly? Like, why aren't you taking care of your grandparents? And I was like, what do you mean? But it was like, but it keeps coming back on me. I was like, he saw through all of this. That was like, wait, why do you have to have specific housing for your senior population? Like, why don't you
get
live?
the premise.
Why don't you take care of your elders? And it's like, that's something we all, I think, need to be thinking about and questioning. Like, how can we better take care of our seniors? How can we better take care of our elders?
Well, and so, tangents are us, but like, one of the things that I think is really interesting, and that sort of goes to some of what we were talking about before our call, which is just with all the parents working from home and trying to juggle everything, how wonderful is it to be able to have, your parents that are 65 and above mostly, to be able to help care for your kids, or people, those elderly people as well. And so sort of, I remember at the beginning of this thinking, man, if this is not a call for wanting sort of everyone under one roof in some way, to be able to juggle and manage this and to have joy in it while not spreading infection, like, I don't know. What are your thoughts around that?
It's interesting. We've thought about the multi-generational kind of housing model is one that like we don't see a lot of, especially in like affordable housing. Like we don't typically design for like a 1-bedroom or a 2-bedroom apartment. And I would love to see more of, because I think there are a lot of communities, especially in our like immigrant communities and communities of color, like you do see a higher proportion of kind of multi-generational living. I do think as we talk about infection control, it's been something that's come up with our team about how do you then protect your elders from infection when they're in multi-generational family living situations and may not have their own bathroom or their own entry or have access to be able to kind of self-isolate if they need to or are at high risk, or if they're living with, a young child who is going back to daycare or is being exposed now to school programs that then they're bringing that home. And so I don't know what the answer is there.
I think I was more thinking of like Little House on the Prairie style. We all just stay here and hunker down. But yeah, but then when you start to think about like, okay, mixing, some of the models that mix, for instance, college students and seniors, and you're like, yeah, maybe not right now. So could you just walk us through some of those principles? Like, what does it look like to design safe space for interaction during all of this?
Sure. I mean, I won't go through all of them, but
Yeah.
I think some of the highlights. I mean, one thing I will say is like as we're talking about different housing types, whether it's like multifamily or whether it's like a one bedroom home or whether it's in like um, a single family home. We tried to think about all those different types of housing possibilities and felt like it wasn't one size fits all. There's no way to come up with infection control guidelines for all of those different types. There's
Yep.
also, just even within those types, just personal like risk
Yes.
limits, right?
Yep.
And so what we did is we tried to define generically, the spaces of like the public spaces that exist where things might be kind of at a higher risk
Yep.
because they are literally in the public domain. Um, we then tried to identify what might be considered like semi-public, maybe some like shared spaces that are still outside and open to the public, but maybe within the, kind of bounds of like ownership by the resident.
Mm-hmm.
The semi-private might be things that are kind of shared, whether it's like a corridor that gets you to your apartment, or whether it's like a porch that's maybe shared with some of your neighbors. And then you have like the private areas where you can actually kind of have zones where you have like the greatest amount of infection control and typically where your risks are lowest.
Mm-hmm.
But we recognize that like even in that distinction between like public, semi-private, and private, there's kind of like a slider bar
Yeah.
for each individual where like what those spaces are would totally change. So if I'm living in, multi-generational housing and I'm an older adult living with my, daughter and her 4-year-old, my, kind of private area actually might be my bedroom. I may
Mm-hmm.
not even have it at like the door to our, apartment or the door
Yeah.
to our
Yeah.
home.
Yeah.
Whereas like someone else who's living in maybe a smaller type of multifamily development might say, actually, like I feel pretty good about like my 8 neighbors and we all use the same spaces and we're basically like a pod. So like
Mm-hmm.
my threshold of like private space actually extends into my lawn. Like there might be different ways that
Mm-hmm.
we see that kind of toggling back and forth. And that's really
That's a
what we
good point.
focused on, was trying to help people understand those thresholds
Yeah.
and where for them there would be this exchange between what we in healthcare call dirty spaces
Yeah.
and clean spaces.
Yeah.
So dirty spaces kind of meaning where typically as like a doctor coming into a patient room, you kind of know, okay, this is now a contaminated or a potential risk of infection by coming into the patient room.
Mm-hmm.
And a clean space is where I'm like taking off all of the PPE I had on in that experience, and I'm like re-entering into what we see as like a lower risk zone. And so we
Yeah.
tried to apply that same kind of thinking to the affordable housing space.
Nice.
And so some of the principles though. So once we kind of said, okay, like we're not going to try to like say that this guide is one size fits all. We're going to try to come up with some like diagnostics here
Yeah.
and give you some food for thought.
Yep.
And then, let's look at it in terms of like just best practices. And I
Yeah.
think first and foremost, making just spaces breathe better.
Yes.
Right.
Yes.
We're starting to all agree that COVID-19 can be transmitted through airborne particles,
Yeah.
Opposed to what we sort of thought early on.
Yeah.
And so, making sure that there's appropriate and proper quantities of fresh air
Yes.
delivered to residents, that we're evaluating our HVAC systems, and that we're creating these well-ventilated spaces throughout the building. Operable openings, I think, can supplement air dilution,
Mm-hmm.
but, also, other types of mechanisms to actually ensure that the air is flowing the right way, especially as we think about like multifamily housing.
Mm-hmm.
And we think about, oftentimes the way that we bring fresh air in is by like assuming that there's some like leaks underneath the door and there's some ways
Yes.
that we
Yeah.
might share
Yeah.
ducts and have some efficiency.
Yeah.
And so, evaluating the systems to actually fully understand where they are, I think is a first step.
Yeah.
And then looking for ways to bring in adequate quantities of fresh air and having the appropriate air exchanges is like fundamentally across the board.
Right. Okay. Can I ask you a question? I'd love to hear your thoughts on this, which has just been like rolling around in my head around this specific topic that you just brought up, which is like, okay, we need, essentially, it would be ideal if we somehow had 100% outside air. And that we understand that that means either through our systems that, they are going to be running, well over capacity. We need to like triple, quadruple the size of all of our HVACs, or we need to, open up our windows or whatever. But my question is like, in order to, thinking about synergies between sustainability and what we're talking about right now,
Mm-hmm.
right?
Yeah.
I feel like there are spaces where, yes, of course, you need to filter all of that and it needs to be the right temperature. But like, when are we as humans going to just go like, okay, and now we have to adjust to being either less comfortable
Mm-hmm.
or like dressing differently, or, I don't know. Do you have any thoughts around that topic?
Well, I think it's funny because actually, like we at Mass, our office in Boston, like right before the pandemic hit,
Yeah.
had this kind of like funny smell in the office that we couldn't quite figure out what it was. And so our solution was just to like open up all of the windows. And so for like the weeks as the pandemic was like coming on, and as we were all like working, and everyone started to talk about, shutting down their
Yeah.
offices, we were all like in March in Boston just putting on a sweater and working at the office with the windows open because it smelled, but also like recognizing that like we were getting incredible airflow and probably like, could have been helping ourselves
Yeah.
throughout the entire spring, by having just like more adequate open air. But that's not really what you're talking about. But I do think, I think that's what we're going to hopefully see more of, is just more people, especially in like our institutions, like schools and hospitals, where like we pretty much like seal them off, right, and
Yes.
rely almost entirely on
Yes.
HVAC systems, that there would be more operability or opportunities for bringing in fresh air.
Yeah.
Also what's interesting about like systems, like not to promote like passive house specifically, but it's a I don't know if you know the passive
I
house
do, but say a few words
certification, but
about it for anyone that doesn't.
well, it's essentially like it is a kind of sustainability criteria system, right? Which
Mm-hmm.
really prioritizes really sealing the building in some ways through insulation,
Yeah.
but it actually brings in incredibly high amounts of fresh air.
Mm-hmm.
And so it is something that we're looking at on a number of our projects. And, it's not passive. It's not like a passive ventilation system. It's actually quite the opposite,
Yeah.
but it does require a large amount of fresh air, which could be a model to look at as we think about, how to build for the future.
Yeah. Yeah. Totally. Um, I think across the board, I also, that some of those strategies that you're talking about, it's like, where is the synergy between how we want to live as human beings, like
Mm-hmm.
what, and what our earth can take, and keeping safe. And I do think that there are these wonderful synergies, but that they're not always easy. Like, you know what I mean? I don't know. It's not always like the default into ease.
Or maybe not the most comfortable,
Yeah.
right? Like I think it's the how much are you willing to be like uncomfortable?
Yes.
And
I think that's what I meant by easy. It's
yeah,
like it takes us going like, I am going to change my definition of comfort to have a wider range. And I'm going to accept greater variability in like, either what people look like on screen or how I dress or whatever. Um,
yeah,
yeah, I think that we've gotten used to a very small window of comfort. I would love to see this be a time where we start to expand that out because it is safer from an infectious,
yeah,
but it's also, here's the thing, it's also safer in a lot of ways that we do not understand, because a lot of times our indoor environments are filled with toxins, from whatever
yeah.
is off gassing. I always joke with people that are like, I just love that new car smell. I'm like, just so you know, it's literally like toxins being released into the air. Like, run,
Yeah, please
run.
unroll your window. Yeah.
Yeah, no, that's great. So, okay, so you had talked a little bit about thresholds. Can you help sort of define what you mean when you say thresholds and why they're so important?
Yeah. So, I mean, I think that, I mean, thresholds are really these moments where the
Yeah.
environment shifts. I mean, people talk about thresholds in
Yeah.
many different conditions, right? But I mean, a threshold can be literally a threshold
Yeah.
that you walk through, and it can be denoted in that way very clearly. It can be a door, it can be an entry, it can be a portico. Like it can be something that you know
Yeah.
that you're passing through. But oftentimes in infection control, the thresholds between spaces that are clean and spaces that are dirty aren't
Yeah.
always clear.
Hmm.
And so, one of the points in the guide that we point to a lot as well is about, spatial
Yes.
literacy, and about really keying people in to understanding through wayfinding, through
Hmm.
design, through visual
Hmm.
cues, um, that their space is
Yeah.
somehow changing, and that their potential risk is also somehow changing, and to take additional precautions, or additional, whether that's additional cleaning, whether that's avoiding a space, whether that's just putting
Yeah.
your mask back on, or taking it
Cueing
off.
behavior.
Those are, I think,
Yeah.
cueing behavior, exactly.
Yeah.
Some of that can even be just like,
Yes.
sequencing flows, sequencing the way people kind of go through like the ritual of their day in
Hmm.
some ways. Um, and, letting people know like where to go, so that you just really are limiting like that
Yeah.
unnecessary mixing. So, that's, I think, how we can create more intentional interaction when people want to be interacted with, when they're prepared to
Yes.
be
Like,
interacted with. As much, yeah, it's as much as it is just, letting
right.
people know where to
Again, with
go,
the
right?
synergy between the social dynamics where there are those layering of like, when do you want to be alone versus choosing to be together? And at the same
Hmm.
time, those layering of COVID risk. And I feel like, again, there's those synergies, and that the concept of thresholds is important for both, because you can go into a threshold and say, all right, and now, like, now I'm in my office, which may be out in public, but there's somehow like some sort of definition of that space versus moving through.
Yeah.
Yeah.
Yeah. I mean, it's interesting, because I think that one of the things that stood out to me, that, is in
Hmm.
creating this guide, was actually that a lot of the fundamentals of infection control do align with when you actually start creating and designing meaningful community
Yes.
spaces.
Say more.
And they aren't yeah, they aren't necessarily at odds in the way that you think they would be. And part of that, comes from, we had done some initial research when we were designing this project called the Maternity Waiting Village in Malawi, which was essentially like a dormitory for
Yeah.
expectant mothers to come and wait in close proximity
Mm.
to a hospital, right? But they had like the program, or like the design of it, was supposed to accommodate 30 some
Yeah.
people, 30 some women. Um, and we immediately recognized that, like, just the design that they had was essentially this
Mm-hmm.
like barracks. It was like 30 people, one room,
Mm-hmm.
basically like a ward, and it didn't make any sense as to kind of the
Yeah.
social structures, and also just how you actually could build meaningful relationships
Yeah.
while these women are waiting. Some of them were waiting there like
Yeah.
6 weeks, right? So there could be an amazing
Yeah.
relationship and programmatic opportunity. And so we started doing research into social networks and understanding the scale at which social
Yes.
interaction most meaningfully happens, and also doing some locally contextually appropriate kind of conversations to understand, how that applied in Malawi and in this rural context in Malawi. And so we went from creating like a bedroom for like
Yeah.
36 women to one bedroom for 36, to creating bedrooms of,
Yeah.
4 people. Um, and the way it was described to us is that 4 made
Mm-hmm.
sense because two is too
Mm-hmm.
few. If you went into labor and your roommate or wasn't there, then like you wouldn't have the
Yeah.
support of others. If it was 3, you could have some like dynamics that weren't quite equal
Mm-hmm.
potentially, and then 4 allowed you to have multiple different configurations of people.
Love it.
And so that was kind of the smallest number we could get to. And when we thought about senior housing, we started designing for senior housing as well. It was housing for
Yes.
community, right? For living in
Yes.
community. And when you think about some of these multi-family
Mm-hmm.
housing developments that are
Oh
upwards of
my God.
100 units, 150 units, 200 units, and you think, how do we actually create community
Yes.
at that scale? I think like
Yes.
Dunbar, as this researcher that came up with this number, right? That like 150 people is like the most
Yep.
names or people that you
Yeah.
can
Yeah. Yeah.
meaningfully have a relationship with, right? So we started looking at ways you could break down the scale and how you could have units kind of centralized into sort of smaller clusters through the design and smaller neighborhoods. And that's part of the point. One of the points in our guide as well is like grouping the residents into what we call
Yes.
villages, right? So small
Yes.
clusters that kind of form this happy medium between complete isolation and complete exposure. I think a lot of people are calling them pods now, right? Like this idea of like pods in education, right? Where you like pair up as families. Well, trying to actually manifest that in the design of our spaces, I think is allowing people to like come together, but it's also the scale, and it meets like our infection control parameters, right? Like no more than 10 people, right?
Like our natural,
but it's also like the kind of people that
yes,
you know.
exactly. Like it's fascinating how closely our natural social dynamics for wanting to be 12 or less to that actually being so similar to, okay, and that's your ideal, like you don't want to spread outside of that. And it's so interesting to me. So I actually had, I'd wanted to talk with you about villages because Julian Holt Lundstedt and I had a conversation like months ago where we were just talking. This was like when COVID had first hit, and we were sort of starting to talk about sort of what this means and all of the ins and outs, and talking about some of the places in Italy and other places that are still secure and are still okay. And it's that much more closed village mentality. And I think you guys mentioned the greenhouses. Do you want to talk about that? It's a very different type of greenhouse than we're used to hearing about.
Yeah, sure. I mean, it's a great model, the Greenhouse Project, which is specifically for assisted living, which is not what our guide is about, but there are some lessons there that I think, for years now, advocates have been sort of saying, how can we better design, assisted living models or nursing care settings to not be so institutional? And it's essentially a village of, residents who really just have like their own bedroom and bathroom, but with a shared living room and a shared kind of common kitchen where their food is served at a smaller scale of, I think, somewhere between 8 and 10 kind of residents coming together. And typically they have access to like a front porch or an outdoors. And it's also, what's interesting as it relates to COVID is also like how the staff model works with that. And it's really interesting. And I love looking at it as a model also for how we might think about new forms or new models of housing.
Say more.
It's kind of like if you've heard of like the co-housing kind of trend. I mean, I know it's popular in San Francisco. There's some here in New York and Boston. Where basically, you have kind of common shared programs that bring people together, like, a shared larger kitchen and dining room and maybe a lounge or like kind of a living room space. And you really only have ownership of your bedroom and like a smaller space. And so as we think about kind of pods or small village living, I think there's some really interesting precedents out there. There's some research coming out, and maybe you know more than I do about some research coming out about sort of analysis of how well the Greenhouse Project has weathered COVID.
I've been dying to hear some of it. I mean, I remember following when the Greenhouse Project sort of first started and thinking, oh, wow, this this is such a good model. And then when all of this happened, thinking, oh my God, I'm going to see if I can find that and put it in the show notes if I can, because that'd be super cool.
I'll send you, I briefly read an article, not enough to talk about it, but I'll send it to you as well.
That'd be awesome.
It. But it definitely was a point of inspiration for at least a step towards that. Obviously in senior affordable housing, it's independent housing. We don't have the reliance on staff. There's also what's interesting is like the funding streams in affordable housing that mandate sort of what's included and what's in basis and what's outside of it. And so that additional level of like, I think, inability to innovate or modify is really challenged by our funding. And I think I hope that part of what this guy is advocating for is that, some of these elements that in the kind of QAP or like the kind of
what's
funding kind of requirements, it's the allocation plan. So it's basically that doesn't probably help anyone understand.
At least now there's better Googling. Go on.
Yeah. But it basically sets out all of the design guidelines and requirements for affordable housing in order for you to access the government funding. So it mandates how big it can be. It can mandate like whether you have a dishwasher or not. It can mandate whether or not you're allowed to put a
Right?
balcony, right? Which like balconies are seen as
Luxury items.
luxury
Yeah.
items, which I think,
Maybe that's
I think of like my own experience living in the city, in
yeah.
multifamily housing during this pandemic, and, how precious a fire escape was, and how precious a community garden
Mm-hmm.
was, right? That we could actually have access to that, 10, you know,
Square feet.
whatever, 80 square feet
You're like,
of a landscape, right? It was amazing, but it was,
yeah.
and so, balcony, especially as you mentioned, Europe and some of these
Yes.
smaller villages, like where those were moments of social interaction for
Yeah.
people,
And shared outdoor
I
space
think
and
is,
share, like, yeah.
yeah. And how we could use this as a moment to sort of advocate for maybe a reexamination of what is seen as
I,
essential and what is seen as
yeah.
luxury.
Oh, I love that. Yes. Use it as a moment to re-examine what we see as essential versus what we see as luxury. I think that's a takeaway quote for me. That's really good. Okay. So, one of my top questions would be, is there anything that you wish more people knew around designing environments for social health, social connection, and or sort of just ways that you think that you wish more people were considering in design?
It's interesting. I mean, I think one of the things that I'm
Mm-hmm.
interested in is you touched about it a little bit earlier, kind of like how we don't fully understand the impact that going through this pandemic is going to have on our senior
Yes.
population, or really on any population. And there's kind of this nascent field emerging, in design around like trauma informed
Yeah.
design, which is really, in terms of trauma informed design, it's a care
Mm-hmm.
model, but now we're starting to think about how that applies to the design profession. And, I'll share this because I think
Please.
that, when I previously mentioned to someone something about trauma informed design, they were like, well, what
Yeah.
do you mean by
Yeah.
trauma?
Yeah. Please define.
Like, very good question, right? And so I think, like, as it's, there's a general statistic that something like 60% or two-thirds of us as adults have experienced some kind of adverse childhood experience, which is some
Yeah.
form of trauma, whether that was like abuse or neglect, or whether that was divorce, or even just
Yeah.
economic hardship. And so when you think about like this broad, or even just
Yeah.
like mental health or substance abuse problems, right? So when you think about this broad sort of experience that we're
Mm-hmm.
having right
Oh
now,
my
as
God.
people
I
are
know.
going
I
through
know.
undue like economic hardship, or shifts in their family structure, or
Schooling from
shifts in
home. Yeah.
who they
Yeah.
schooling, right? Like,
Breaks in the culture.
um, and so it's really going to become this like universal experience. And I think it really needs, the design then I think needs to shift and actually acknowledge not just our physical health, but also our mental health, and spaces for wellness, and acknowledge, spaces that can be
Yes.
triggering, and spaces that
Yes.
can be
And
healing.
physical
And
and mental. I mean,
yeah,
I'm
so
just
I mean,
saying, physical and mental kind of one and the same thing. I feel like we always separate them, but I
yeah,
mean, you probably know the research as well as I do, but the thing about that child trauma that you just mentioned is that it shows up in our genes and it shows up in our kids' genes. I mean, it's crazy. It is crazy to see you're born with one set, but a lot of these have sort of ways of either turning off or on certain expressions of those genes, and that trauma may bring out things that we otherwise wish that it wouldn't. And childhood trauma is a predictor of later health outcomes like cancer. I mean, straight up, just,
mm-hmm,
you know,
yeah.
basic health outcomes, disease outcomes. So, I mean, I think it can't be overstressed like that they are one and the same, and especially what's happening in our childhood. So that's great. Please, yeah, go on.
And yeah, I mean, I would only add that, I mean, I think, you and I both, I think, fundamentally agree that like space
Yeah.
shapes behavior, and space can shape how you feel, and it can do so in a
Yeah.
negative way, and it can do so in a
Mm-hmm.
positive way, right? We at Mass, we talk about things, spaces that hurt and spaces
Mm-hmm.
that heal. um, and I just add that as like, as we think going forward, I hope more of these lessons from, evidence-based design, or designing
Mm-hmm.
for health, will continue. It won't just stop at infection control or at designing, for infectious disease or mitigation of that, but that we'll start to look at other ways that designing for health and can start to come into housing, come into our schools, come into our museum spaces, come into our restaurants, and really start to create, beautiful, dignified spaces and healthy spaces.
Amen to that. Well, that is probably a fabulous way to wrap this. I'm just like loud claps over here. Patricia, it is so much fun to talk with you. I feel like I could just talk with you for hours, and love to hear all the cool stuff that you guys are up to. And I just so appreciate you taking time out of your busy schedule to share your perspective and your story with us. So thank you.
No, it's been really, really delightful. Thank you so much for including me.
Thank you so much for joining us on this episode of The Space Between Us. If you enjoyed this episode, I hope you'll take a minute and subscribe and rate on Apple, Spotify, or wherever you get your podcast. And check out my website, erinpv.com, for more information on loneliness, social health, the built environment, and so much more. We are constantly sharing research and other resources on there and would love to hear from you. I hope your day is filled with honest emotions, kindness, and connection. Take care.